At 11 weeks pregnant, your baby is developing faster than ever, and your body is working hard behind the scenes in ways you may not fully realize yet. This is a crucial stage in your pregnancy, where major changes are happening both inside your baby's body and in yours. In this video, we'll walk you through everything you need to know about week 11, your baby's development, the symptoms you may experience, what's normal and what's not, and how to take care of yourself during this stage so you can feel more confident and prepared. Welcome to your week-by-week pregnancy guide. At 11 weeks, you are nearing the end of your first trimester, a very important milestone in your pregnancy journey. This is the stage where many of the early foundational developments are becoming more refined, more structured, and more complex. Even though you may not look very pregnant yet, a lot is happening inside your body, and your baby is growing rapidly every single day. Let's start by taking a closer look at what's happening with your baby this week. First, let's talk about your baby's development. At 11 weeks pregnant, your baby is now about the size of a fig, measuring around 4 to 5 centimeters long. While that may still seem very small, your baby has already gone through some incredible transformations. In fact, your baby is no longer just an embryo. They are now considered a fetus, and they are starting to look much more like a tiny human. One of the biggest changes this week is the development of your baby's face. The eyes, which were previously positioned on the sides of the head, are now slowly moving closer together toward the front of the face. The ears are also shifting into their final position on the sides of the head. These changes may seem small, but they are very important in forming your baby's unique facial features. Your baby's head is still quite large compared to the rest of the body, and this is completely normal. This is because the brain is developing very rapidly at this stage. Inside the brain, nerve cells are multiplying at an incredible rate, forming connections that will later control movement, thinking, and basic body functions. This is the foundation of your baby's entire nervous system. Another exciting development this week is movement. Your baby is now able to make small, spontaneous movements, such as stretching, kicking, and even tiny hiccup-like motions. These movements are happening naturally as the muscles and nerves begin to work together. However, even though your baby is moving, these movements are still far too small for you to feel at this stage. Most women will start to feel movement later on in the second trimester. Your baby's hands and feet are now fully formed, and tiny fingers and toes are clearly separated. In fact, your baby may already be opening and closing their fists, which is a big step in muscle and nerve development. Inside the body, vital organs are continuing to grow and become more functional. The liver is beginning to produce red blood cells, which are essential for carrying oxygen throughout the body. The kidneys are starting to produce urine, and the intestines are moving into their proper position. Your baby's heart is also beating strongly, pumping blood throughout the developing body. Although you may not hear the heartbeat yet without medical equipment, it is already a powerful and reassuring sign that your baby is developing as expected. Now, let's shift focus and talk about your body and the symptoms you may be experiencing. At 11 weeks pregnant, your body is still adjusting to significant hormonal changes that are necessary to support your baby's growth. Many women also describe this stage as emotionally and physically unpredictable. Some days, you may feel almost normal, and other days, these hormonal shifts can affect you in many different ways, and it's important to remember that most of these symptoms are completely normal. One of the most common symptoms is nausea, often referred to as morning sickness. Despite the name, nausea can happen at any time of the day, morning, afternoon, or even at night. This is mainly caused by rising levels of pregnancy hormones, especially HCG. For some women, nausea may still be quite strong at 11 weeks, while for others, it may begin to improve as they approach the second trimester. If you're experiencing nausea, eating small, frequent meals, and staying hydrated can help manage it. Fatigue is another very common symptom during this stage. Your body is working continuously to support your baby's development, producing more blood, supporting the placenta, and maintaining hormonal balance. All of this can leave you feeling unusually tired. You may find that you need more rest than usual, and that's perfectly okay. Listening to your body and allowing yourself to rest is very important right now. You may also notice breast tenderness. Hormonal changes are preparing your body for breastfeeding, which can make your breasts feel sore, heavier, or more sensitive than usual. Wearing a comfortable, supportive bra can help reduce discomfort. Mood swings are also very common at this stage. You might feel happy one moment and emotional or overwhelmed the next. These changes are largely due to hormonal fluctuations combined with the emotional experience of pregnancy. It's important to be patient with yourself and understand that these feelings are completely normal. Another symptom you may experience is frequent urination. As your uterus continues to grow, it begins to put pressure on your bladder. This can make you feel the need to urinate more often than usual, even if you haven't had much to drink. Food cravings and aversions are also very typical during this time. You might suddenly crave certain foods, while others that you used to enjoy may become unappealing. This is another effect of hormonal changes and heightened senses like taste and smell. Now, let's talk about something very important: what's normal and what's not. Every pregnancy is different. Some women experience strong symptoms, while others may have very mild symptoms, or even none at all. Both experiences can be completely normal. You might notice that your symptoms change from day to day. For example, nausea may feel worse one day and better the next. This kind of fluctuation is usually nothing to worry about. However, there are certain signs that should not be ignored. If you experience severe abdominal pain, heavy bleeding, persistent dizziness, or fainting, it's important to seek medical advice as soon as possible. These symptoms are not typical and should always be checked by a healthcare professional. If you're ever unsure about what you're feeling, it's always better to be cautious and consult your doctor. It's also important to remember that pregnancy symptoms can sometimes overlap with other normal body changes, which is why self-diagnosis is not always reliable. Even small changes in your body can feel amplified during pregnancy, so having medical guidance helps you separate what is normal from what needs attention. Now, let's talk about how you can take care of yourself during week 11. Taking care of your body is essential, not just for your baby's development, but also for your own well-being. At this stage, your body is working 24/7 to support rapid growth, increased blood production, and hormonal balance. That means your daily habits now have a direct impact on how you feel throughout the day. A balanced diet plays a key role during this stage. Focus on foods that are rich in essential nutrients such as folate, which supports your baby's brain and spinal development, iron, which helps prevent anemia, protein, which supports growth and tissue repair, and calcium, which is important for strong bones and teeth. But beyond just knowing the nutrients, it's also important to understand how they work together. For example, iron helps carry oxygen in your blood, which can directly reduce fatigue. Folate supports early brain formation, which is happening very actively right now. Calcium and protein work together to build your baby's developing bones and tissues. Try to include a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats in your daily meals. A simple way to think about it is to aim for color in your plate, because different colors often represent different nutrients your body needs. Even small, consistent changes in diet are more effective than trying to be perfect every day. Staying hydrated is equally important. Drinking enough water supports your body's increased blood volume and helps with digestion, energy levels, and overall health. Many women underestimate hydration during pregnancy, but even mild dehydration can increase fatigue, headaches, and dizziness. Aim to drink water regularly throughout the day, even if you don't feel very thirsty. A helpful tip is to keep a bottle of water nearby at all times, especially when resting or working. Getting enough rest is also crucial. If you feel tired, don't ignore it. Take breaks when needed, and try to maintain a regular sleep schedule as much as possible. At 11 weeks, your body is still adapting to hormonal shifts, which means your energy levels can change suddenly during the day. Short naps or rest breaks are not a sign of weakness. They are actually part of supporting a healthy pregnancy. You should also avoid harmful substances such as alcohol, smoking, and certain foods that may not be safe during pregnancy, like unpasteurized dairy or undercooked meats. If you're unsure about a specific food, it's always better to check rather than assume. A simple rule is, when in doubt, choose safer and fully cooked options. Regular prenatal checkups are very important at this stage. These visits allow your healthcare provider to monitor your baby's growth, check your health, and address any concerns you may have. They also help detect any issues early, even before symptoms appear. Think of prenatal visits as progress checkpoints. They give you reassurance that everything is developing as expected. Now, let's go through some common questions many women have at 11 weeks. One common question is it normal if my symptoms suddenly decrease? In many cases, yes. Symptoms can fluctuate and may begin to ease as you approach the second trimester. But here's something many women don't realize. Symptom intensity does not always reflect pregnancy health. Some women have strong symptoms, others have mild ones, and both can still be completely normal. However, if you're concerned or notice sudden drastic changes, it's always a good idea to check with your doctor. Another question is, can I feel my baby moving at 11 weeks? At this stage, your baby is moving, but the movements are still too small to be felt. These early movements are happening automatically as your baby's nervous system develops, but they are not strong enough yet to reach the uterine wall. Most women begin to feel movement later in the pregnancy, usually between 16 and 22 weeks. You might also wonder, can I exercise during this stage? In most cases, light to moderate exercise, such as walking or prenatal yoga, is safe and can even be beneficial. Exercise at this stage can help improve circulation, reduce stress, and support better sleep. However, always consult your healthcare provider before starting or continuing any exercise routine. Another common concern is sleep. Is it okay to sleep on my back? At this early stage, it is generally still safe, but as your pregnancy progresses, sleeping on your side, especially your left side, is often recommended to improve blood flow to your baby. A helpful habit you can start now is gradually getting comfortable with side sleeping, even if it's not strictly required yet. Finally, many women ask, is my baby developing normally? This is one of the most common concerns in early pregnancy. The truth is, the only reliable way to confirm development is through regular prenatal checkups and ultrasounds. These allow your healthcare provider to track growth patterns, heartbeat, and overall progress. Try not to rely only on symptoms to judge development, because pregnancy can vary widely from person to person. As you move into week 12, your baby reaches an important milestone, the end of the first trimester. This is often when many early symptoms begin to improve and the risk of complications decreases, making this a more comfortable and reassuring stage for many women. Many mothers also describe feeling a sense of relief and renewed energy around this time. Be sure to watch our next video on 12 weeks pregnant to see what exciting changes are coming next in your pregnancy journey. If you found this video helpful, subscribe for weekly pregnancy updates, baby development guides, and tips to help you have a healthy and confident pregnancy.